So a study came out recently that what some of us knew or had an idea of the origins of coronavirus, that there were further evidence that it began in animals in Wuhan market. So it basically is on CNN Health, and it's by Katherine Dillinger. So this just came in today, that studies offers further evidence that the coronavirus pandemic began in animals in Wuhan market. And so I kind of feel like the reason why they didn't want to talk about it so much and they tried to steer clear of it is because of the anti-Asian hatred and the racism that had took place, and the blaming um, of people who are not even living over there, that live here in America, and just because they look or have similar features, or they're being harassed, they're being attacked, they're being blamed for something they didn't create. And so I wanted to say that in there, that it's dumb, it's stupid. I mean, the people that have been targeted don't even live over there. I mean, they have went through a lot just because they look like or look to be like a part of that group. Um, yeah, they may be Asian, but that doesn't mean that they come from Wuhan. So it's a lot of hatred. It's been a lot of hatred here in the U.S., and so I believe they tried to steer clear of this because they didn't want to add more insult to the injury, so to speak. So two preprint studies posted Saturday offer further evidence that the coronavirus originated in animals and spread to humans. And this was in late of 2019 at the Hunan seafood market in Wuhan, China. Okay, so one of the studies, neither of which has been peer reviewed, so make that clear, or published in a professional journal, used spatial analysis to show that the earliest known COVID-19 cases diagnosed, this was around December of 2019, were centered on the market. And so remember, as far back as that, when they had started closing the market down, and then they started penalizing the people who were running those wet markets? Well, that was some of the reason why. So the researchers also report that the environmental samples that tested positive for the virus, which is SARS-CoV-2 or CoV-2, were strongly associated with live animal vendors. And so I just want to say that I feel like, and correct me if I'm not on this, I feel like what happened, and I said this, is that if it came from that market, there was a couple of scenarios. So let me go over the first one. That the people that live in that country, that was their source of income, is those wet markets. They're popular, and primarily popular with tourists. So I feel as though the tourists who have a lot of money, they come from somewhere else, another country, and primarily the U.S. So when they travel from the U.S. to go to these foreign countries, they like to eat these exotic foods. And the more exotic, the more expensive exotic foreign foods they eat, they can take photos of it, and then they can tell their friends, and they can talk about where they traveled, and what adventures they came across, and that they went to the wet market and look at all the exotic foods, the bats, the whatever they saw that you would normally probably see here in the US, or not out in the open. And that's like a big deal for some people to spend a whole lot of money on an exotic dish. But the people in that country, maybe that's the way they make their money, is through the tourism. So those animals probably carry certain diseases and things that maybe in human consumption is not safe for human consumption. And so when people eat that and then come back, you're in contact with people on the airport, on the airplane, around in the markets, you're walking around. If you, after you've eaten and you've gotten sick, and then you bring it back to the US and then it spreads everywhere. And that's probably one scenario. That's what I'm saying is how it probably ended up spreading. Is somebody from here went over there and brought it back here. The scenario number 2, they mentioned something about a lab. They said there was a lab in close proximity and that they do testing on animals. In labs, they do tests on animals. And so what do they do with those animals? They have to discard those animals. So if those animals have diseases in them and they're testing them to see if the animal is able to thrive with that disease, or how long do they have to live, they can determine how this will affect the human. If they have an animal that has similar human characteristics or traits, maybe they do test on animals and then they discard these animals. Or maybe someone, a vendor, may ask, do you have animals that you don't no longer need that might not be, a bad thing for them to take those animals or whatever, and then somehow those same animals that they've done all those lab tests end up in that wet market. And they skin them and clean them and sell them off to these tourists because they're not going to eat it. They're vendors. They're trying to make money. And so maybe they get these animals and they say they're going to get rid of them, but they actually resell them in these wet markets. That could be another way that these viruses and diseases got out to someone who was traveling from the U.S. and went over there and ate and came in contact, maybe didn't even have to eat the animal yet, just touching it. They somehow came in contact with those diseases and then it spread everywhere. And then by them eating it, made it worse. So that was scenario number 2. So those were the 2 scenarios that I came up with because I recall watching a documentary about this animal called a pangolin. And that is supposed to be an outlawed type of animal. And when you go to the certain countries to get that dish, I think the dish is around $4,000, $5,000. And so tourists come to eat that, and the people that live in that country, that's how they make their money. And that $4,000 or $5,000 lasts them maybe the whole year or more. And so they're not to talk about doing that dish. They're not to have those animals. It's like it's illegal in that country. And so if you ask them in that language about that particular dish, everybody acts like they don't know anything about it, but they do. And there's like a secret code that you have to say to get the right person to say that you're not the police and that you're not going to get anybody in trouble or arrest them for giving you the name of the restaurant that will prepare that dish. And so there was an undercover journalist and then a person who was willing to try that pangolin dish. And I believe the dish in that country was worth like 4,000 or 5,000, maybe more of their money, which goes a long ways for that person in that country. And so that dish is supposed to be outlawed, but that pangolin carried some of the, I believe it carried the coronavirus that was one of the animals. So I think there's more than one animal that if you eat it, it has already those viruses in it automatically. And so I'm thinking that would have been one of the ways that it hadn't gotten out. Maybe, when you see some of these food channels, I don't know if anybody is familiar with this, but there was this guy, he would travel all around the world and eat these wild dishes. His name was not the guy from the court trial, Zimmerman, but his name was Zimmerman. And he was the food critic and the food guy. He would try all these wild dishes, stuff that you probably would be like, "Pew, I'm not eating that. Yucky." But he would try all these exotic dishes. And so he's not the only one. And I believe there are other people that's their thing, is they call themselves a foodie. And so they travel to all these places and they eat these things that you probably wouldn't believe in your wildest imagination that people will be drinking and eating from, gamey animals, or animals you think that don't have any nutrition values whatsoever. Why are you eating that crap? And so in those animals there might be certain germs that if a person eats it later, maybe in the beginning they don't get sick, but later they might come down with a fever, they might come down with whatever it is that animal had, because now you're putting it in your body, and then anybody you come in contact with now, they're sick just from being around you. So moving along, those were the scenarios that I had came up with that I felt like could have been really the way that had spread so fast, because it makes sense. Like, to get on the plane you have to be around people, to go to the airport you have to be around people, to be walking around in wet markets and grocery stores you got to be around people. If you're a traveler, you're around a lot of different people. So if you're sick and you're contagious, then that's room to spread whatever you're sick with to lots of people. And so I believe that would have been one of the ways, or there could have been other ways as well, but that would have been one of the probably ways that it had gotten out. And then some people came up with issues that maybe somebody could have been angry in that lab. They knew that it was contagious and they were wanting to target certain groups, and then it ended up getting out and it targeted everyone. Everyone was vulnerable, no matter what income source you have, if you're poor and on up to the wealthy. And so that was the last and third scenario. And all of those could have been possibilities. I kind of think that the one where the food consumption might have been the main one, but the main culprit. So the other study said that two major viral lineages, going back to this article, were a result of at least two events in which the virus crossed species into humans. Now let's see what they come up with. So the first transmission most likely happened in late November or early December of 2019. The researchers say that other lineage probably introduced within weeks of the first event. And so experts have roundly condemned the theory of a laboratory origin, and that was the one that I was saying it is the third and last laboratory leak. Okay. And so a lot of people were speculating because they said there was a lab not that far from the wet markets. So many of the researchers behind the new study were also participants in the review published last summer that said that the pandemic almost certainly originated with an animal, probably at a wildlife market. And so those were the first two scenarios that I came up with. And so that's probably more than likely what happened. So the new studies take this area of research to a new level, and are the strongest evidence yet that the pandemic had animal-related and zoonotic origins. So Michael Warrelby, a professor and head of ecology and evolutionary biology of the University of Arizona, told CNN Warrelby was the lead author of a geographical study and co-author on the other paper. And so he called the findings game, set, and match. So for the theory that the pandemic originated in a lab, it's no longer something that makes sense to imagine that this started any other way. So Worrelby, he likened the pattern to the coronavirus initial spread to a firework with the market at its center. Okay, and so the explosion started in 2019, but the pattern had changed completely by January and February 2020, a hallmark of the virus seeping into the local community. And so the study notes that December 2019, COVID-19 cases were geographically distributed unexpectedly near to the center on Hunan Market. And so, irrespective of whether or not they worked at or visited or were knowingly likened to someone who had visited the market in late of 2019, furthermore, those cases epidemiologically linked to the market. And so the overwhelming majority that specifically linked to the western section of the Hunan market were most of live mammal vendors where they were located. And so the live mammal vendors. And so COVID-19 origins, why the search for the source is vital. And so when the researchers tested surfaces of the market for the virus genetic material, there was one stall with the most positives, including the cage where one researcher had previously seen mammals called raccoon dogs being kept. And so findings are as close as having the virus and animal as you can get. So Robert Gary, professor of microbiology, immunology at Tulane Medical School, told CNN. So Gary was the co-founder on a study that found at least two zoonotic animal transmission events. So it notes the pandemic began with two major viral lineages called A and then B, although it says there were probably even more forms of that virus that failed to establish into humans. Okay, so there were more viruses and there were more things there, but they weren't able to, how would you say, jump species. I guess that's the way, like transfer into humans and then becoming a full on virus. But this one was successful, of course. And so lineage B is the more common of the two, and the only one that had previously been found at the market. But the study says the lineage A was also circulating around the area early in the outbreak. And so the virus most likely started with at least two animal transmissions, with a raccoon dog or another mammal serving as the intermediate host before it spread into the humans. That's what the study has said. And so, when considered along with the reports, the SARS-CoV-2 infection to animals like big cats, deer, hamsters, this shows that this is a virus that just doesn't care what it replicates in. And so it can multiply and get into other animals and species. So I'm taking it that's what it means. So this was said by Gary. So Gary and Worrelby say that the studies show the urgent need to pay attention to situations in which animals and humans interact closely on a daily basis, and we need to do a better job of farming, regulating these wild animals, Gary said, and invest in infrastructure in places where viruses spill over. And so Worrelby also said that human surveillance is crucial to preventing future pandemics, adding that experts and officials should be better at detecting cases and respiratory diseases with no clear cause, isolating patients and sequencing viruses. And this is not the last time that this happens. And we know this. Now, before I go to the next article related to coronavirus, I believe this person here, he's talking about the origins of the virus. And so that's what it's basically talking about, the studies of it. And so, and this was by Katherine Dillinger out of CNN. And so that's where the sources are from. So I want to say there's another article about coronavirus news. Now, this is more about how it's impacted the schools here in the U.S. And what I've known, and I can kind of share about this, is that there's a lot of testing every week. There's masking, depending on who gets sick. Um, the schools will close down. Now, they, as in they, the media here in the U.S., likes to paint this picture that the pandemic is over and we're ending everything. We're going to open up schools, we're going to take away the masks, and we're going to do all these things and go back to normal. Let me tell you why this is happening, because this thing, we're in the third year of this. They realized that they can't save everyone, and they did have a full-on scale lockdowns earlier in 2019, late 2019. Well, it was more like 2020 was when we had our lockdowns here. And I'll say in late of 2019, that was more in China, when they were already on alert and they were warning the U.S. and the president we had, or formerly had, knew about it and didn't do anything until after the fact. Once it had hit the U.S., or it was already here, but once it started to really replicate and spread, and become a real issue, that's when the alarms were sounded, especially when it was sounded in, I believe it was Italy, is when people were taking notice of how devastating it was there. The other thing is that this pandemic is not over like they want to say it is. More people will die, but it's, I think, a gradual type of thing, and now it's left up to the people, as in just civilians. You have to do due diligence to stay healthy as much as possible. If you see the signs that you could have been infected, now we know enough information about these viruses to know, where to get help. I believe there's still testing going on in some places, but I believe that some of the schools are going to end their testing. There's still vaccines that you can get, and I believe it will eventually end up being a situation just like the flu vaccine. You'll have the choice of getting it every year. The vaccine for the COVID virus, and I believe it will mutate. There'll be worse forms that'll come out along a period of time as it begins to evolve. And so with the next article that's similar about what's going on, is the big problem with this virus. It has affected a lot of people, where people ended up, outside of just getting sick and, people getting infected or worried about getting infected or dying, is the job loss. And then jobs that people don't feel comfortable working at because they're afraid they're going to get it. This is going to continue. Because people know that this virus is still out there. There's no controlling it. There are actions you can take to try to prevent getting real sick, but I believe something else is going to come where the shots won't work, and you really won't have that much of a choice. And I hate to say that, but I'm just being real here. So there's a huge teacher shortage, and the teacher shortage is so bad that you have not only the teacher shortage, you have a shortage in most of the professions, even outside of the schools. Jobs, hiring signs everywhere, people still kind of in limbo. Where is it safe to work? Because they know now enough information that we're being fed not always the truth through media. So, teacher shortages, mask mandates, and every day is a test for principals. So, principals have quietly marched on throughout the pandemic, trying to keep their schools from becoming health, academic, um, and social disasters. And so, while children and teachers have borne the brunt of COVID 19's impact on the U.S. educational system, the coronavirus has brought unprecedented problems principals have had to solve to keep schools running. So, new guidance from the Center of Disease Control and Prevention mean that many schools may drop their mask mandates, but the decision will carry its own controversy. So, this is a map showing the COVID 19 vaccinations in the US. And it says there's a total number of US people who have received at least one vaccine shot. And so I believe they had 124,290 to 216,876 by that point, and then it shows states and confirmed cases, and this is 8,961,636 confirmed cases of I believe people who have gotten infected with COVID, and the California's deceased is 85,043. And so Texas is at 6,612,192, and their confirmed deceased is 84,775. And so it has Florida at 5 million, which is 5,844,229, and their confirmed deceased is 69,790 people. And New York is at 4 million, so I believe California is the highest out of all of them. 4 million for New York confirmed cases, over 4,922,707, and their deaths are 67,300 people in Illinois, and then it goes on and on and on. So you could look at this by the numbers, coronavirus cases across the U.S. And so this is a lot of people that have died by far. And so it is in the millions. And it's not stopping. It's just slowing down. And I feel like it's receded because there's mutating going on, evolving going on. It's learning us. It's learning who's got shots, who doesn't have shots, our bodies, maybe how how it can be stronger against the vaccines. And I believe that's what's going to happen. But as it has receded, people feel that everything is back to normal when it really isn't, because there's been a lot of job loss. There's been a lot of evictions, unfair evictions. There's been a lot of lawsuits. There's been a lot of anger. There were lockdowns. People felt like they were losing their business. They were losing their mind. So it was devastating. There was a lot of people that died. As far as I'm concerned, things aren't normal. And then we have climate issues, and so on top of that, that's a whole nother issue in and of itself altogether, which they have not begun to tackle. And so it has been really, really hard. And so even now, you have even the teachers that struggle to be in their classrooms. It isn't the same as it used to be. They're not getting paid what they're worth, and it's hard. So with that being said, we'll see what the rest of 2022 brings, because it has been very, very tough. And this virus, as far as I'm concerned, I feel like more is going to happen, but it's going to be gradual, and then there are going to be other things that are happening. Like right now, we're looking at a war that's going on between Russia and Ukraine, and then we're also looking at, the the impact that the virus has left, the aftermath, and I believe there's more that people that are on alert. And there's so much that has gone on over this past year and the past 2 years prior. So it's a wait and see thing, which you don't want to hear any more bad news. But I feel like when you're prepared and you know what's coming, you're not shocked and you're not unprepared, or you're not in a state of mind where you're like, nobody told me this was going to happen. And so I feel like when people kind of know what could come, that they can better prepare for it, and then it's not as much of a shock, and then they could do all they can to fight through, or either make it through those tough situations rather than wait for them to just force themselves upon you. So this it's unfortunate because the kids have suffered a lot. They had schools closed for a while, so that was a loss. Some kids don't learn well online. Every kid is a different learner, just like every person's a different way of learning and doing things. So they lost a lot of their learning, like for a couple of years. So we'll see what the future brings. But I will say it's not gonna be, simple. But I think most of these decisions were not just the people, the civilians, people who live in the communities. It's the lawmakers and the people who are in government and the people who run the country that make these decisions. And you see what the impact of it, what it leaves behind. And so that's the big thing. And so to pay attention to that, because, people point fingers at just regular people who have no control over this. The people who do have a little bit more power are the ones that we see that we elect, the ones that people think they're doing something and they're not really doing anything, or they're doing too much of the wrong things. They're making laws trying to hurt people instead of focusing on climate change. They're making laws trying to discriminate people from doing certain things instead of looking at how are we going to protect people from the next pandemic that could come along. So those are the things that they should be worried about instead of trying to restrict people from freedoms and civil rights. And so those are other issues that I've been seeing lately. It's trying to stop people from voting. And so it's been really rough. And from looking at the way they're governing, it doesn't look like they're making it any easier.